Now, I'm sure that all of you here tonight are familiar with how to record recession. It's simply the measurement from the CEJ to the gingival margin. And I know that you're all familiar with measuring the width of keratinized tissue, and that's the distance from the gingival margin to the mucogingival junction. And of course, we all know how to record probing depths. But what you may not be familiar with is the classification system for recession. This classification system is important for you to know because it allows us to offer our patients the appropriate treatment options depending on which category they fall into. By knowing the classification system, it also allows us to present treatment to our patients in the proper sequence. And it also, very importantly, allows us to give our patients realistic expectations from their treatment. Because what we don't want to do is overpromise and then underdeliver because we miscategorize the patient. The classification system that we utilize in periodontics is that devised by Dr. P.D. Miller. This is an article published in the International Journal of Periodontics and Restorative Dentistry in 1985. And let's begin by looking at Miller's category Class 1 recession. The important feature here with Class 1 recession is that the tooth demonstrates recession, but there's no interproximal bone loss on either side. And that's very important in helping us to predict our results. So keep that in mind. No interproximal bone loss. And here you see a great example. The papillae fill the embrasure spaces. And if we probe around these teeth, we'll see that the probing depths are very shallow. 2 millimeters, 1 millimeter, 3 millimeters. And what this tells us is that we've got good bone support between these teeth. So this is Class 1 recession. Here are the CEJs, and here are the mucogingival junctions. So this is the amount of recession that's taken place. Here's our mucogingival junction. So the distance from the gingival margin to the mucogingival junction is the width of keratinized tissue. This principle comes to play all the time. We can cover roots to within 3 millimeters of the tips of the papillae. And this statement comes from an article by Dr. Pat Allen, and I'll reference this article in more detail in a few minutes. But keep this principle in mind, because if we measure 3 millimeters from the tips of the papillae, we're right about here. So with Class 1 recession, complete root coverage is possible. And let's look at the appearance of these teeth before and after treatment. And indeed, you see that complete root coverage was attained. When we go to our periodontal chart, and I'd like you to take a look at your handouts, and on page 2, you'll see the periodontal chart that we utilize in our office. We're still utilizing a paper chart. We haven't gone digital with our charting yet. And the reason for this is because I haven't seen a digital charting system that allows us to chart recession and to chart non-carious cervical lesions. So we're still using a paper system. I'll be going to the American Academy of Periodontology meeting next month, and I'm going to be talking to the software vendors to see if any of them have incorporated this into their charting system, or at least have the ability to customize their charting system so that we can include recession classification and non-carious cervical lesion classification. But in the meantime, if any of you want to use this chart in your office, please feel free to make copies or call us for more copies. We'll be glad to supply you. Now, if you go to the next page of the handout, you'll see the explanation of all the different symbols and letters that we're using when we classify and record periodontal problems. And I'm not going to go over these right now, but if you ever see a periodontal chart come from our office and you're wondering about what some of the letters and symbols mean, here's your legend to let you know. But if we go back to this patient and we look at the situation here, we see that we have 3 millimeters of recession, and that's this first number 3. We have 3 millimeters of keratinized tissue, and that's the second number 3. Our crevice depths on tooth number 8 are 2, 1, and 3, no interproximal bone loss. And so our recession classification is Class 1. Let's contrast Class 1 recession with Class 3 recession. And the important distinction with Class 3 recession is that interproximal bone loss has taken place. And look at the appearance here. We see these black triangles between these mandibular anterior teeth. So we've lost gingiva, and more importantly, we've lost interproximal bone. Here are the CEJs, and if we apply the principle of root coverage being possible within 3 millimeters of the tips of the papillae, and so we measure 3 millimeters apically from the tips of the papillae, and then we connect those points with a line, we see that root coverage is only possible up to this level. And this is where I'm coming from when I say that we don't want to overpromise and underdeliver to our patients because we didn't categorize them properly. This patient has class 3 recession, so we don't want to tell this patient we're going to be able to cover these roots, because we're not, at least not in 2011. Now the field is developing rapidly and there's always changes taking place. Maybe in a few years we'll be able to. So keep in mind, with class 3 recession, complete root coverage is not expected. We take a look at the appearance of this patient before treatment and their appearance after treatment, and we have to ask ourselves, was surgical treatment really appropriate for this patient? Well, the answer is yes, it definitely was appropriate, but for a different reason. Take a look at the thickness of the tissue. This is practically paper-thin tissue. It's so thin, so delicate, that further recession is expected. But if we look at the appearance of this tissue following surgery, we have much thicker, healthier tissue, and this tissue is going to resist further recession. Now, is it always going to resist further recession? Well, there's an old adage in dentistry that the dentist cannot do what the patient cannot undo. The patient can always undo through neglect or abuse. I mean, if you have a patient that's brushing vigorously, yeah, they can abrade this tissue too. But if they're doing a good job with their oral hygiene, if they're doing proper oral hygiene, this tissue is going to be very resistant to further recession. So our goal with treating class 3 recession is to create thicker mucosa that's going to be more resistant to further recession, but we have to watch those exposed root surfaces for signs of wear. So let's review the important points. We know that we can cover the roots to within 3 millimeters of the tips of the papillae. With class 1 recession, no interproximal bone loss has taken place, so therefore complete root coverage is possible. But with class 3 recession, interproximal bone loss has taken place. Now, we can achieve thicker mucosa. We can make this tissue more resistant to further recession, but we're going to have incomplete root coverage as a result, and so we have to watch those exposed root surfaces for signs of wear. And what do we call it when wear does occur on these exposed root surfaces? We call it the formation of non-carious cervical lesions.